Hello, my name's Jimmy Turner. I'm a research fellow at the University of Edinburgh. I work for a kind of a small research centre called the Binks Hub, and we focus on conducting participatory research with and for communities, which uses in some way, shape or form artistic and creative practices and methods in the course of conducting that research. In my background, I'm an anthropologist and gender studies scholar. And I work in an interdisciplinary group with other social scientists. And whilst our focus is not explicitly on mental health, health inequalities and well-being is a key research strand of ours, and very often mental health and well-being are part of the picture in the research that we do. In our hour-long session, we're going to have really exciting and interesting presentations from three researchers. I'll be chairing the panel. The first paper will be given by Roesch-Marsh, who's a social work academic, and she'll be presenting with the title, "The Value of Poetry for Social Workers' Mental Wellbeing." And in this presentation, she'll be talking about a recently completed project that she worked on, which worked to produce a toolkit which can be used by practicing social workers to help them reflect on their practice and on their lives more broadly. And it predicated on the findings of their research that working with and through poetry can really help social workers in terms of managing their mental health, the stresses, strains, anxieties, etc. of the work. The second presentation will be given by Megan Hatcher, and really excited that Megan's joining us because she's a practicing art psychotherapist who's been working on a project in connection with people in the university, but she's not university based, so she's going to bring much more of a practice focus to things. Her presentation is going to be is called "An Art Psychotherapy-Based View of Clinical Spaces: What Makes Inpatient Forensic Mental Health Environments Good Places to Be." And this presentation is based on what she and her colleagues found when they ran a project with people in inpatient mental health environments to produce a mural for the space. And they got really interested in the ways that space can be made and remade through art. So she'll be talking about the experience of conducting this project and what they found to be the impacts of this kind of work. The third presentation will be from Candela Sanchez, who works in the Health in Social Science School here at the University of Edinburgh. She's a human geographer by background and an artist. And in her presentation, which is called "Creating Relational Poems Towards a Place-Focused, Voice-Centered Relational Method," she'll be talking about the ways that she's used drawing alongside and within interviews with participants in order to work towards understandings of anxiety and other mental health issues that they have. For myself and my colleagues broadly in the social sciences, I think that mental health is something which we are increasingly all having to take an interest in and have an awareness on. It's moving out from the shadows. It's less siloed than it used to be. So we in sort of general terms, as a collection of disciplines in the social sciences, are increasingly talking about, researching, taking an interest in mental health, including, we should say, our own as well. We're a lot more open than we used to be in terms of talking about the pressures and stresses and strains of the job and the lives that we live outside the job. And in our more specific area of thinking about and thinking with and through artistic and creative practices, let's say, and methods, we're finding that giving people, the participants in our research, the opportunity to work with us artistically is certainly not universally the best approach, but is an approach which very often pays dividends. And we can do that in a number of different ways. We can use the arts in order to accompany more traditional social science methods. So, for example, we can introduce artistic and creative activities into interview or focus group kind of environments in ways that can make many, although by no means all, but can make many people feel more comfortable, feel less like they are being, interrogated by a researcher. We can also integrate them a bit more deeply and think about and take an interest in the process of using the arts and how that can help people to understand their own mental health difficulties and mental health conditions, but also to communicate more effectively their experiences of their mental health and the mental health of those around them. We can perhaps take it to another step and think about people's artistic and creative outputs, as we might put it in academia, as expressions of their knowledge about mental health. Yeah. So if we think about mental health, very often we find that artists are and have been very effective at communicating knowledge about mental health through their artistic practices. We can think of many painters, poets, authors, musicians who express something that's readily understandable by many other people in the world about the experience of mental health through art. And at times much more easily and much more readily and perhaps much more comfortably than they might be able to through the spoken or the written word. So as social scientists thinking about about mental health and working in areas where mental health and well-being are either the main or at least a significant part of the picture, giving the people that participate in our research the opportunity to be able to express what they know about themselves, their lives, their communities, and their loved ones through art can very often be the most effective and comfortable way for them to express that knowledge, rather than the more traditional social science research methods.